Our next speaker, Sheri Straw. She is the president and CEO of the ALS Network, formerly ALS Golden West, one of the largest nonprofits in the nation focused on ALS. With a master's degree in public health and another in business administration, Ms. Straw has excelled as a nonprofit leader, community advocate, and public speaker. Ms. Straw has been on the executive teams of several of the largest nonprofits in California, providing critical strategic visioning and effective leadership. Ms. Straw currently serves on the board of two highly respected nonprofits, LS United and Child and Teen Counseling. I met Sheri the first time at a reception of the Death Valley Challenge. I was impressed immediately by her distinctive and charismatic leadership. She's great at making people cry and laugh. So let's welcome Sheri.
Thank you so much. It's so great to be here with all of you. Thank you to iXCells for having us. And what a day it has been. I've learned so much from all of you. So thank you for that. It's very generous. And thank you for setting that up. So, okay, I need more hands. So here we are. I'm sharing about the ALS Network today. I'm going to tell you a little bit about who we are, what we do, giving you an idea of the patient advocacy part of the ALS ecosystem. And then I'm also going to tell you a little bit about how we interact with industry and what our research program looks like. And you can read our mission right there for you. I'm not going to read it out loud. You've got that. And I do want to point out that ALS Network, it's a newer name in the ALS nonprofit landscape. And you may, if you've been around ALS for a while, especially in California or Hawaii, you probably know us as ALS Golden West chapter of the ALS Association. We did leave the ALS Association a little bit more than a year ago. And with that, we changed our name to ALS Network. Fret not, we are the same organization that has been proudly serving the ALS community for more than 30 years. We are deeply, deeply mission driven, and we are passionate about the work that we do. You will all relate very much to this. Lives are at stake, and people are counting on all of us. So we work with a sense of urgency. We tend to be very driven, very nimble. We're not afraid of change. We're not afraid to do something in a completely different way. We're known for being innovative and also very collaborative. People often share that, it's so easy to work with you and we love working with you and thank you for collaborating with us. And we usually feel the same exact way. And, the ALS community comes first in everything that we do. And that is the perspective from which we frame our decisions. We work through 3 mission pillars. I'm going to tell you a little bit about all of them. One is care, one is advocacy, and one is research. But first, let me tell you a little bit more about our scope and scale, if you will. You heard Nyanwe mention that we are one of the largest ALS nonprofits in the nation. We rank around 4th if you remove the nonprofit hospitals and medical centers. We do directly serve more than 2,000 people with ALS each year. We also serve the entire family ecosystem. So if you take that number of people with ALS that we're honored to work with, we're also working with loved ones, caregivers, family members, and oftentimes friends. There are people who are completely alone with ALS until we meet them. We make sure no one is alone with this disease, and we mean it when we say that. To date, we've raised more than $19 million that's been invested in ALS research. More than 50,000 different advocacy actions have been taken nationwide. And we do have 3 physical locations. 2 are in California. 1 is in Hawaii, but we really work across the region with staff working remotely throughout the state and across Hawaii as well. So you're gathering California and Hawaii. Yes, that is where our in-person boots on the ground services are focused. However, because we serve so many people with ALS, we do have programming that's relevant for others who live in other places. These are things where we have the critical mass and other regions don't. So anybody from anywhere can come and participate in those services. And an example, a couple of quick examples to kind of give you, what does that really mean? We have support groups for people under 50 with ALS, unpartnered people with ALS, LGBTQIA plus people with ALS, Spanish language support groups for people with ALS, and so on and so forth. Anyone from anywhere can come on in and find community with us. And as I mentioned, we're known for collaborating across the ALS ecosystem. And, we are the ALS network, but there are other ultra super duper, I'm creating a new ultra super duper rare diseases that mimic ALS. These are people who often don't find themselves in any of the other organizations. So we do also serve people with diseases that mimic ALS. So moving right along, let's start by talking about our care services and what do I mean by that? What is that all about? And again, tying back to, I think it was Yael's presentation earlier about patient advocacy organizations and the power of what they're up to. And the beauty too of what your patient advocacy organizations are doing is we're helping our medical professionals, our research professionals focus on their roles, and we can step in and bridge those gaps so everyone can keep their eyes on the prize, right? So every person with ALS that we're connected with is provided with a regional care manager. And these are people in their communities who know where's a good place to go where I can come in with a power wheelchair and get a haircut. I mean, really simple things, and also very complex things like navigating ALS, which is different, as you've heard, different for everyone. So these care managers provide concierge one-to-one services for people and families throughout their entire ALS journey. And this includes doing things like safety checks in the home. And those safety checks are important, again, throughout the journey as ALS progresses, providing referrals, providing information, social and emotional support, help navigating benefits. This is a very complex medical system that we live with here. And there's a lot of assistance that's needed for people to really maximize those benefits. We know that the out-of-pocket costs for someone with ALS can go as high as $250,000 a year. So really leaning in and maximizing benefits is critically important from early on in the diagnosis. I mentioned those support groups. We host more than 30 each month. And we also have equipment loan programs, and these are really important. This can be very expensive, durable medical equipment and communication devices, either things that are not covered by insurance at all, which is all too common, or also all too common, lengthy delays once the prescription has been written for the piece of equipment. We help loan equipment so people can start accessing it right away, even if they aren't able to get it right away through their providers. We are also proud to host educational webinars through what we call our Ask Me series. They live in a library online, so people who are newly diagnosed can access a webinar from years back that's relevant to them today. So a lot of educational materials and resources. And if you know someone with ALS, or you find yourself interacting with someone with ALS, feel free to connect them to us at the ALS Network. And if they're not in a place where we provide support, we will happily connect them with their local patient advocacy group too. Okay, so advocacy. Oh, my friends, is there ever a need for advocacy? Today, in fact, today is a day you can do. I'm going to invite you to do an advocacy action today because we need you. So advocacy, we're talking about policy and legislation to benefit the ALS community. We're doing this locally. We're doing it statewide in California and Hawaii, and also across this beautiful nation. We really focus on, you have our focus areas up there. We focus on access issues, things where there are policy problems that are creating barriers to access to key medical, and also this includes equipment, funding for research, and of course, generally raising ALS awareness across our legislative bodies. We know that awareness is often the first step, that familiarity breeds affinity. We want people to know more about ALS so that when we have an ask, they will say yes. Related to that, I'm going to invite all of you to find an example of an ALS network action opportunity. If you find us on social media, ALS Network, or sometimes we're listed as your ALS Network, just last week we put out an action alert that enables anybody to go in, you put in some information, it will automatically identify your representatives, provide a template letter that you can customize, and then you push send and it will kick it off to those representatives. The action alert we sent out last week was specifically about the NIH cuts that are proposed that are absolutely devastating to the research ecosystem in the nation, not only for ALS. So if you want to if you've been feeling like I want to do something, research is so important, how can I help? There's a nice, easy way you can send a letter on that very important issue. So let's talk a little bit about research. We're really, as a patient advocacy organization, as the ALS Network, we are focused on supporting every person with ALS who's in front of us today, making sure they have the very best of everything that's available to them, and also taking action to help prevent ALS tomorrow, right? And this means accelerating the search for effective prevention strategies, treatments, and cures. And you heard from the presenters already today that we're not there yet. We're working on it, we're getting there, but we have a lot more work to be done. So how are we accelerating this search as a patient advocacy organization? Through a few different things. First, thought leadership. We need the best ideas, the best minds coming together. We need Don and Justin sitting next to each other and duking it out and arm wrestling. And Don is known for asking very difficult questions. You have a little bit of yes, you do have a little bit of a reputation for that. It's good. It's pushing the field forward. So every year we host the ALS Network Research Summit, bringing together about 250 researchers. It was very lovely to have iXCells here with us this January. And again, putting out what's happening in the field, what's working, what's not working, how can we learn, how can we keep moving things forward. We do also have, related to thought leadership and really encouraging thought leadership, the Fred Fisher Excellence in Research Award is a new research award that we're launching. We plan to announce the first recipients in next January to really help inspire others to be mavericks in their thinking, to take good risks. And then recruitment. So again, your patient advocacy organizations and the ALS Network, when it comes to ALS, we take research recruitment very, very seriously. We would like our researchers, our biotech companies, our pharma companies really focused on science, and we can be a great asset and are a great asset to to helping to populate that research that you're doing and get it fully populated faster so that we can get things going. And we also help populate other research opportunities. It's not only clinical trials. There are a lot of other ways the ALS community is participating in research, including, if you don't already know this, there is a national ALS registry that's hosted by the CDC too. So then funding research, I'm going to talk a little bit more about that momentarily, but another way the ALS network is contributing and accelerating research is by directly investing in it. And we take this very seriously and are proud to do it. And then collaboration. It's going to take all of us. It's a very complicated disease, and we're happy to be collaborating to help accelerate, act as a catalyst to our friends doing this research. We have a world-class scientific advisory committee. 2 of the members might be sitting in front of me, who you heard from earlier. And again, we're happy to collaborate with them and have their input and great thinking informing the research that we're funding. We also co-fund research. We're very open to that and love doing it. We co-fund research with ALS United. We're also proud to be a member of ALS United, and it's exciting to be pooling dollars to propel research. We co-fund research with the ALS Cure Project and also with Target ALS. So again, this example of how patient advocacy organizations and nonprofits can pool their dollars to really push good science forward faster. We're at the table for that and oftentimes leading that. So this ties to partnering with industry, and it's important and we're happy to be doing it. How do we do this? How do we go about this? So the first part I mentioned, directly funding research. So we're looking at high risk, high reward, smallish grants. ALS Network in late April, we're launching our first request for proposals, and we will be funding 7 innovation projects at about $150,000 each. It's open to anybody in the United States. So anyone, anywhere, if you have an innovative ALS idea up your sleeve, please submit an application this spring and put your hat in the ring. The other thing that we're doing, I'm going to mention one other thing about our direct funding and that request for proposals opportunity. Something that we're also being really aware of, and again, this goes back to the urgency concept, is okay, we want to directly fund research. It's got to be great. I'm not a scientist, so these guys are going to figure out, and the 22 other people on the scientific advisory committee, they're going to decide which are the best ideas that should be funded. But how do we do that quickly? So we're working within a very nimble approach. It's a brief application followed by the people who are invited, make it through the paper application screening, are invited for a fast pitch session. And we're doing this fast pitch with the reviewers. They're face-to-face. We know scientists oftentimes don't get an opportunity to interact with reviewers at all. They'll be able to interact, Q&A, right then and there. The applicants jump off, and then the scientific advisory committee makes a go, no-go decision pretty quickly. And then we will rapidly move from there into contracting, and then we'll plan to issue the funding in the same year as the application is submitted. So again, how can we be additive in this research space and bridge gaps and do it differently? And I want to also mention that you can be a biotech company. You can be for profit. You can apply for funding with us, even if you're a for-profit entity. Again, we want to fund the best science. And in fact, one of the projects we're funding this year ties to Don Cleveland's presentation where there may be an alpha-synuclein subtype in ALS. So we're funding an innovative company named Amprion who's looking into that to confirm if there may be a subtype in sporadic ALS related to alpha-synuclein. So then advocacy, education, and consulting ties to community-centric approaches. We are there. We have a community research committee made up of people from the ALS community, people with ALS, caregivers, direct lived experience. And these are folks who can interact with our research partners, who can come in and make sure, is your trial design community-centric? What does a person with ALS think about what you, researcher, scientist, are planning to do? And are you on the same page? We can bring that perspective into the room, and we're happy to do that. And a lot of the advocacy I mentioned, education as well. More than once, I've come into a biotech company or a pharma company and provided a presentation or been on a panel about what is patient advocacy and why does it matter? And just really making sure to help the scientific community understand that. That's a service that we can provide here at ALS Network. We also have found ourselves, we're pretty good matchmakers. We have connected scientists. We're talking to so many of you, and we'll talk to one over here is doing this thing, and we'll realize you need to talk to this one over here. And so let's put you together, make the magic. Okay. And now it's up to the rest of you. And there have been some really powerful things that have happened because of that. So we have fun doing that and also help, again, propel innovative ideas by doing that. And then we also partner with industry as a way for industry to give back and a way for industry to be in the community that they're working so hard for. And one of the things I learned that I was surprised to learn early on is that there were a lot of scientists in labs who never met someone from the community. So then we have an opportunity to make that different. And there are a lot of companies who have the ethos, who want to make that different. And they're the ones who we see at our community events. I'm going to talk a little bit more about that in a moment. So one way everyone here who's from California can make a difference this year, if you want, I know you all want, like, who wants to help directly fund ALS research? I mean, everybody wants to, right? Everybody wants to do that. ALS can affect anyone, so it's on all of us to be a part of the solution, right? Here's how you can do it in a really, really easy way. If you're in California and you are filing your income tax form, on that voluntary contribution part towards the end, don't skip over it. Stop there. And we're the newest on the list, which means we're last. Not my favorite spot to be in. I'm going to be honest. I was hoping it was work the other way. Newest at the top. Scroll all the way down. We're code, it's line, but they use the word code 447. It's the California ALS Research Network is what you're going to hear. California ALS Research Network. 100% of those dollars will be reinvested in ALS research in the state. So I encourage you all to donate any amount, and to encourage your circle to also donate any amount. So one easy way you can make a difference. And then you can also get involved in, Michelle talked a little bit about this morning. I think it was Michelle. Yeah. Talked a little bit about this morning. Join us in California or Hawaii at an event. We have so many different things that we're up to. And there, we have rides and we have walks and golf tournaments and, you can hike and you can do whatever. We have people who paddle across oceans. to do this. We have a gala, all sorts of beautiful things. There's something for everyone. The other thing is you can be creative about how you're going to interact with the patient advocacy organizations you're connected with. And I love the example of iXCells, who participated in the Death Valley ride. And that is a way to get involved. You know, we were a part of that as well. Denali has come up a couple of times in presentations. Denali and Cytokinetics, that each year they host an executive splash where they set up dunk tanks and people can pay to throw the thing and dunk the CEO. And that's a fundraiser and a fun way of getting involved. So we'd love to see everyone here involved. If ALS isn't your thing and ALS Network isn't your thing, that's okay. There's a patient advocacy organization connected to what you're up to, and absolutely being involved in supporting their work. They're supporting your work. We're supporting your work. So you can support the work as well, and also be in the community, right? It's the people with ALS who are making so much of the research possible once it gets out of the lab. So there's also that thing, you know, how do we give back to them? And it really is by being involved. It really is, in whatever way that's meaningful for you. Okay, that's everything that I have. And I just want to say thank you for your work. And thank you for this session, and for our ALS researchers here. Thank you for choosing ALS. Thank you for choosing rare diseases. It's not easy work, and we need each and every one of you. So thank you so very much.